Hello, everyone, and welcome to Nurses Notes 101. My name is Alexa, and today we are going to go over acute pulmonary edema, which is in the CCRN. It is 17% of the exam. This is, I think, the fourth bullet in cardiology. So, pulmonary edema is the accumulation of fluid in the alveoli, which is the air sacs in the lungs, that causes gas exchange disturbances. There are two main causes of pulmonary edema. This includes cardiogenic causes or non cardiogenic. So, with cardiogenic causes, the disease processes that could cause this are heart attacks, so acute MIs, acute myocarditis or inflamed cardiac muscle, or severe heart failure. Cardiogenic pulmonary edema is caused from an ineffective left ventricle, which causes that pulmonary congestion from the fluid backing up and volume overload. Non cardiogenic causes of pulmonary edema can be direct or indirect. Direct non cardiogenic causes include acute respiratory distress syndrome or ARDS, pneumonia, or carbon monoxide poisoning, and smoke inhalation injuries. Non-direct, lung injuries causing pulmonary edema include sepsis, which increases, capillary permeability, shock, which does the same, along with acute pancreatitis, which can also increase capillary permeability. Signs and symptoms of pulmonary edema are cardiogenic or non-cardiogenic in nature, just like the causes. Cardiogenic symptoms would include tachypnea, low oxygen levels in the blood or hypoxemia, frothy pink sputum, which is a very typical sign of pulmonary edema, along with a cough. Pulmonary edema can also cause heart murmurs due to that increased fluid in the circulatory system, and jugular vein distension or increased jugular vein pressures. Non-cardiogenic signs and symptoms of pulmonary edema include crackles or congested lung sounds, could also include rhonchi, which are usually higher up than crackles. Signs and symptoms of pulmonary edema could also include worsening dyspnea or trouble breathing, generalized edema throughout the body, and peripheral edema in especially dependent areas like the legs. If an infection is what's causing the fluid overload, like pneumonia, you'll see a fever as well. Here in this picture, you can see in the x-ray that this is a depiction of pulmonary edema and congestion on what would seem like to me the right side of the lung. Pulmonary edema is diagnosed usually by chest x-ray like we saw on the previous slide. They could also take the patient for a CAT scan, which was on the second part of the previous slide. Um, the pulse ox readings might be abnormal depending how severe the pulmonary edema is, which would show hypoxemia. With an ABG analysis, just like with the pulse ox, the oxygen could be low. And with cardiogenic causes, the usual diagnostic tools that we would use is an echocardiogram to see the heart via ultrasound or cardiac catheterization. At that point, I feel like a cardiac catheterization would be done if the patient's seeing a severe malfunction in cardiac output. Um, if not, I feel like that would be a last resort for diagnosis. So I feel like they'd usually do chest X-ray or CAT scan first. Treatment of pulmonary edema is almost always medical management. So these medications we would use could include usually diuretics, blood pressure medications, inotropes, and pain meds. So diuretics are going to help our body rid the excess fluid and excrete this fluid via urine. If the fluid overload that the patient is having causes high blood pressure, the physician will probably order blood pressure medication to lower that, which could include nitroglycerin, which is a vasodilator, which will help the blood pressure pretty quickly. Let's say the patient has fluid overload due to advanced heart failure. We can wind up giving an inotrope, which will help the heart pump and thus, in return, prevent further congestion because if the heart's pumping more effectively, hopefully there will be less fluid overload. So that's when we can give the patient something like a dobutamine or a dopamine to kind of help the heart along, or a milrinone. Let's say also due to this fluid overload that the patient is having trouble breathing. Sometimes if people have trouble breathing, it is easy to say that they'll have anxiety along with that. A lot of patients with heart failure especially experience this, so we can give them pain medication to help with that shortness of breath and anxiety, like morphine. To the right of the screen, you'll see mnemonics for the treatment of heart failure. Um, in relation to pulmonary edema as well. So, the current mnemonic that we're using from emnote.org is POND. So, it shows that with positioning, with oxygen, with nitroglycerin and diuretics, this should help treat pulmonary edema. One of the older mnemonics that we used to use was LMNOP. And this also included Lasix, morphine, nitro, oxygen, and positioning. But at this point, I think it seems like we're steering away from that mnemonic and staying more towards to the PON mnemonic. All right, and that is it for now. Thank you for watching Nurse's Notes. Please like and subscribe.